Hi, I'm Kathy, and I'm one of the hygienists here at Greeley Dental Care. And for a new patient, if you are a new patient to our office, what we like to do is take a full mouth series of x-rays. We like to do a CBCT, which is a 3D scan of your jaw and all the teeth so the doctors can get a complete diagnosis for you. Then we bring you back and we look at all of your existing restorations or things that you've had done previous before coming to our office. And then as a hygienist, what I do is a thorough gum exam. We want to look for signs of gum disease. We want to look for signs of bone loss and actually walk through your mouth to see what type of cleaning is going to be best for you. During the actual charting process, or what we call periodontal probing, we take a little instrument that it has measurements on it and we walk it through around your teeth into the pocket areas. Our teeth are held into the gums and the bone, and there's a little pocket, like a pocket in our jacket or shirt, that we walk the instrument around, and we get 6 readings on every tooth. That helps us determine the health of your mouth. So if we say 1, 2, or 3, that typically it means that everything is really healthy. 4 is like a caution light when you come up to it. If we don't do something about that 4, something's going to happen. 5, 6, or greater tells us that there's already signs of bone loss and gum disease going on in your mouth. And we address that differently than we would a person that has a completely healthy mouth. So as a hygienist, if we determine that you have gingivitis, we will recommend a gingival cleaning. And what that is going through your mouth to remove all the bacteria and toxins that are creating the inflammation in your mouth. And then we will put you on some protocols. We'll go through home care instructions, brushing, flossing, using a water pick to get your mouth back into health. Typically, we bring you back about 6 or 8 weeks later for a follow-up visit to make sure everything is healing well and that you're back to that normal, healthy state.